Okay, today we are looking at placenta previa. So, placenta previa, we're saying that this is the bleeding per vagina due to premature separation of an abnormally situated placenta. So, I mean to say, you find that this placenta will lie in where? In the partially or in the lower segment. And when contractions start, you find that there will be what? Bleeding. But when you're talking about this one, bleeding is inevitable. So we'll look at types of placenta previa and also the characteristic of what? Bleeding. So types of placenta previa. Number one, we have type 1, also known as lateralis. So this lateralis, you find that this placenta is mainly in the upper segment. But what will happen is that it will also encroach in the what? In the lower segment. Okay? So mean to say it will be doubled in the lower segment and also in the upper segment. So when you say encroach, it also what? It will also embed in the lower segment. So we find that when contraction starts, bleeding will be what? Minimal. Bleeding will be minimal and delivery through the vagina is possible because the placenta is not covering the what? The os. That is type 1. Type 2. Type 2 are saying that type 2 is also known as what? Marginal. So under this placenta previa type 2, which is also known as what? Marginal, placenta is mainly situated in the what? Lower segment. Remember to say that the uterus the uterus is divided into two segments, the upper segment and also the lower segment. So under type 2, the placenta now is what? Embedded or encroaching the what? In the lower segment. This one will reach the what? The internal os, but does not cover it all. So what will happen is that bleeding will be what? Moderate. Vaginal delivery is possible when situated anteriorly. Type 3, which is also known as incomplete. So this type 3, the placenta is situated in the lower segment. So mean to say that segment and the os will be covered. But remember what will happen here is that it is closed but only cover it up to 4 centimeters. So when dilated, so you find that when contraction starts, it will cover what? This placenta will cover the whole 4 centimeters. So bleeding is severe, and this woman won't deliver through vagina but what? Cesarean section. Type 3, also known as incomplete. The placenta will be situated in the lower uterine. Okay, when the contraction starts, that os won't be dilated up to 10 centimeter. So delivery through the vagina is what? Is not possible. So we find that the only delivery for this woman is what? Cesarean section. Let's look at type 4. Type 4, the placenta is situated in the lower uterine segment. Remember, type 4 is also known as complete. So you find that this placenta is situated in the lower segment and lies centrally over the internal os. Mean to say this placenta embedded where? On the internal os, okay, of the cervix. So bleeding is torrential and delivered by cesarean section is the only way. Okay, and when someone has got placenta previa type 4, which is complete, remember to say this is an emergency. Okay, the only possible delivery for this one is through cesarean section. So that is the picture for placenta. So normal placenta, partial placenta previa, and also total placenta previa. Mean to say total placenta previa covering the os, partial covers the os, but when dilated, it will do what? It will not cover the os. Let's look at the predisposing factors: age, multiplicity. So age, those mothers who are over the age of 35 are predisposed to have what? Placenta previa. Okay, multiplicity, irreparity due to formation of fibrous tissue in the segment, that is the upper segment, resulting into multiple scar tissue in the upper segment. So you find that this woman who is multiplicity, the muscles are what? Are weak. This woman has been having a lot of children, let's say about 13 children, 10 children, the muscles are what, or those tissues are what, are weak. So for the placenta to be indented well, you find that it will go into the what, lower segment. Also, multiple pregnancy. Large placenta surface may encroach in the on the what, lower segment, because it's carrying more than one baby in the what, in utero. We also look at grand multiparity. So grand multiparity, this one will result due to loss of what, uterine muscle tone due to frequent pregnancies. Okay, she has been having a lot of children. So this one will cause the fertilized ovum to fall in the lower segment and implant where? Implant there. So that one will come as a result of having a lot of children. We also look at scared uterus. Scaring of the endometrium in previous cesarean section will also lead into what? Placenta previa. Smoking due to hypoxia induced by what? The smoke. So remember to say that in the smoke there is what? That chemical which is called nicotine. So that nicotine will affect also the muscles. Okay, and also gaseous exchange will be induced. So we find that hypoxia will be there. Hence we find that this woman will have placenta previa. Also abnormalities of the uterus such as fibroids in the upper uterine segment. As a result, this woman, the placenta will be embedded in the what? Lower segment. If you find that there are what? Carcinomas, or let's say fibroids on the upper segment of the uterus. Let's now look at signs and symptoms or clinical features of placenta previa. This woman will have painless vaginal bleeding. Vaginal bleeding can be slight or severe, just according to the type of placenta previa the woman has. Onset is usually sudden, revealed, and also repeated. It appears to be causeless. So we find that the bleeding may occur as early as 16 weeks of gestation, but it's more common about 32 weeks. Because under 32 weeks, you find that contractions are now severe. That's why we have Braxton Hicks contraction. So number 2, the uterus is soft, non-tender, relaxed, but can be painful if patient is having what? Contraction. Due to the fact that they will be what? Also bleeding, and the placenta is embedded in the what? In the lower segment. Number 3, the presenting part is high, non-engagement is likely to occur in type 3. We're saying that there will be no engagement due to the fact that the placenta is embedded where? In the lower segment. Where the baby is trying to engage, you find that there is no space for engagement. Hence, the presenting part is high when trying to do VE. Malpresentation of the fetus are common, e.g. transverse or breech. So it is also common, or let's say breech or transverse. Remember to say that the placenta is embedded in the lower segment. Mean to say that placenta, it's also an organ, a temporary organ. When someone is pregnant, which feeds what? Which feeds the baby. So what will happen is that that lower segment will be occupied by what? Placenta. So under this one, find that the baby will be lying where? In the transverse or breech. Okay. Diagnosis of placenta previa. Taking care of history from the patient or relatives may reveal spotting during pregnancy. This patient will tell you that I have been bleeding. Okay, ever since the contraction started, I've been having some bleeding through the vagina. Coitus before onset or any other predisposing factors will reveal placenta previa. So, other one, we're talking about on abdominal palpation. The head will be high due to the fact that the placenta is embedded in the lower segment. So when you try to do abdominal palpation, the head will be what? Will be high. A very gentle and careful speculum exam can be done to exclude polyps, lesion, and also cervical cancer, which can also cause PV. So this woman will come bleeding. So when you're doing your diagnosis, it's also a mandate to do a speculum examination, because it can also exclude what? Polyps, lesion, because you know to say that these they cause what? Bleeding in pregnancy, and also cervical cancer or cervix or cancer of the cervix will also cause what? Bleeding in pregnancy. Ultrasound is accurate in localized the site of the placenta, and it is repeated at 32 weeks, 34 weeks, and also at 36 weeks. Let's look at the management. The management depends on the amount of bleeding, the condition of the mother and the fetus, location of the placenta, and stage of pregnancy. So management at the health. So you find that this patient will come, or this client will come at the health facility. So there you will come the patient, you make her feel comfortable, quickly assess the condition of the patient. If the condition has to take history activities involved at time of onset, and if she had experienced other bleeding episode during present pregnancy. Also review the antenatal card for any risk factors. Carry out a physical exam, noting signs of raised BP, para edema. Do a gentle palpation on note to note the height of fundus, presentation, engagement, and also what if the woman is contracting. Listen to fetal heart sound to determine fetal well-being. Check for bad amount of breathing. Keep also a pad for monitoring or also to assess. Put IV line of normal saline to line slowly or cannulate patient to keep vein open. So those are the management. Okay, so now at hospital, you find that let me just summarize the management. If you discover that or your diagnosis is saying that this is placenta previa type 4, incomplete or complete, just prepare the patient to the theater for cesarean section. If let's say if the pregnancy is at term, you take the patient to the theater. If it's not at term, you maintain the conservative management. Okay, so those are the things that you have to do. So I just want us to look at complications of placenta previa. Okay, so complications of placenta previa. Purpurial sepsis. So this one comes as a result due to the fact that there will be what? Reduced hemoglobin, hence prone to what? Infection. This woman, remember that she was what? Bleeding. So you find that hemoglobin will be what? Reduced. Hence there will be what? Prone to infection. DIC. DIC will come as a result of what? Severe loss of fibrin. Acute renal failure due to severe blood loss. Sheehan's syndrome due to necrosis of anterior pituitary gland. Okay, so we've come to an end of our discussion. We've discussed on antepartum hemorrhage. Specifically, we're talking about the placenta previa. So that's what I had for you, and don't forget to subscribe to my channel.